Hello, my name is Daniel Rojas. I am student nurse practitioner. I will be performing head-to-toe assessment today. Can you tell me your name?
Michael.
Where are we?
Monrovia, California.
And what year is it?
2025.
Very good. All right, I'm going to go ahead and inspect face for symmetry, looking at skin, lesions, checking the throat, making sure it's symmetrical, looking for any lumps. And we'll palpate the head, looking at hair distribution, skin, looking for lesions, trying to feel if there's any lumps or abnormalities. Okay, let me have you smile, frown, and now puff out your cheeks. All right, so we were doing facial nerve number 7. Let's see. Next, I would like you to close your eyes, and I'm going to ask you to tell me where I'm touching you and if it's a sharp or soft object.
Soft object forehead. Hard object forehead. Hard object cheek. Soft object chin. Soft object cheek. Hard object closer to chin.
Very good. All right. That was trigeminal nerve. Have you open up your mouth, open, close. All right. Trigeminal nerve again. Checking for any clicks, T and J. All righty. Next, I'm going to go ahead and start with an eye inspection. I'm going to have you look down. All right. Now look up. Very good. Snellen test was completed. He does have 20/20 vision. That is optic nerve number 1. Let me have you stare at this without moving your head. Follow it with your eyes. Okay. All right, so we are testing cranial nerves numbers 3, 4, and 7. That is oculomotor, trochlear, and abducens. Okay. I'm going to check your pupils. Pupils are round, equal, and reactive. Making sure the sclera and conjunctiva are clear. They look pink and moist. Lovely. All right. So I want you to stare at me. Don't move your eyes. I'm going to cover one eye. Okay, good. No eye deviates while I do that test. Next, I want you to cover one eye and tell me when you see my fingers.
Okay. Okay. Okay.
Okay, let's cover the other eye.
Okay. 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 Okay.
All right, very good. Okay. Next, we are going to test the vestibulocochlear nerve, number 8. I'm going to place this on your forehead, and I want you to tell me if the vibration is equal or greater on one ear than the other.
Okay. Left ear.
Left ear is greater? Left ear?
Mm-hmm.
Okay. All right. Next, I'm going to place this on your bone back here. Tell me when you stop hearing it.
Okay.
Tell me when you stop hearing it.
Okay.
Repeat on the other side. Tell me when you stop hearing it.
Okay.
When do you stop hearing it?
Okay.
All right, go ahead and cover one ear. And I want you to repeat what I'm saying.
1, 2, 3.
Cover the other ear.
ABC.
All right, very good. So, cranial nerve number 8 looks good. Tell me if you have any pain when I touch your ears. Any pain?
No.
Okay. I'm going to check the canals and tympanic membrane. Okay. I'm pulling the ears up and backwards. Okay, they look clean. Good. Wonderful. All right. We have you tilt your head back a little bit. Look up your nose. Looking at the mucosa, septum. Looks wonderful. Wonderful. Can you close your eyes real quick? Can you smell this item? What is
The
it?
lemon.
Lemon, very good. That is olfactory nerve number 1. Okay, now I'm gonna have you open your mouth, stick out your tongue, up, down, side to side. Stick out your tongue again one more time, say ah.
Ah.
Very good. Let me go ahead and smile for me. All right, I'm checking the oral mucosa, teeth, gums. We tested cranial nerves 9, 10, and 12. That was glossopharyngeal, vagus, and hypoglossal. All right, let me have you shrug your shoulders up and down, and I'll do it against my hands. Very good. We are testing cranial nerve 11, that's the spinal accessory. Okay, next I'm going to go ahead and start palpating your head, checking the temporal artery. And then I can listen to the carotid artery using the bell of my stethoscope. Okay, then I'll go ahead and palpate the artery. Very good. Okay, next we're going to check the preauricular lymph nodes, postauricular, occipital, the tonsillary, submandible, submental, the anterior and posterior cervical chain. Then we're doing the supraclavicular. All right, we can go ahead and check his other epitrochlear and the axillary. Sorry if I'm tickling you. Epitrochlear and axillary. Okay, very good. Sorry about that. All right, I want you to tell me if you have any pain when I palpate your sinuses. Any pain there?
No. No.
Okay, very good. Feeling the trachea, looking for the thyroid. Can I have you swallow, please? Swallow again. Okay, I'm checking to see if it's overgrown or deviated. It feels normal to me. All right, let me have you touch your chin to chest, ear to shoulder, then backwards, and then turn your cheek left and right. Very good. This time we will be doing against my hands for resistance. Forward, back, side, and turn your cheek. Very good. Okay, next we will go ahead and test the cerebellum function. Here, I want you to look at my finger and with one of your fingers, touch your nose to my finger as fast as you can. Very good. Next, we'll do the other hand. Repeat the same motion. Very good. Next, we'll have you put your hands up and down like this on your leg. Very good. Let me have you take your right heel of your foot and drag it down from your knee on your shin. Very good. Let's do your other foot. Very good. All right, cerebellar function looks good. Okay, so next we're going to start on the extremity assessment, palpating the shoulders, the elbows. While I'm doing this, I'm doing the radial pulses. Look, there are 2, looking at skin, hair distribution, looking at the hands for any deformities, nodules. They look good. All right, very good. Once again, I want you to close your eyes, and this time I want you to tell me if I'm touching you with a soft or sharp object.
Soft. Sharp. Sharp. Sharp.
Those upper extremities.
Soft. Sharp. Sharp.
Okay, continue with your eyes closed. I want you to tell me if I'm touching you with 1 or 2.
1, 2, 1, 1, 2, 1, 2.
All right, so we did upper and lower extremity. Continue to keep your eyes closed. I want you to hold your hands palms up and then tell me if you feel vibration.
Vibration. Yes. Yes.
Vibration from the
Yes.
All right, very good. Okay. All right, let me see your hands. I am going to be inspecting cap refill. Do you feel me pushing on your fingers?
Yes.
All right, making sure that they refill. Okay, very good. Now, let me see you flex your wrists upward, down, inward, outward, and then fingers down. Very good. Let me hold your wrists up and press against my hand. And so your other hand as well. Very good. And have you hyperextend your fingers as much as you can. Very good. Then wiggle them. Let me do each thumb to finger. Very good. And then cross your thumb across your hands. Very good. Let me hold my fingers, squeeze as hard as you can. Wonderful, feels good. Okay, next I want to test for carpal tunnel. Can you put your hands like this? After 60 seconds, I would ask if you have any pain. Do you have any pain?
No.
Very good. Let me see your arm. Any pain?
No.
Let me do your other arm.
No.
Very good. So we are doing the Phelan and Tinel test, negative for carpal tunnel. Okay, next I would like to hold your arms out like this and extend and flex. Now do it against some resistance. Very good. All right. So I was testing out the bicep and tricep strength there. Can you hold your arms out like this? I'm going to push out against them. Hold it. Hold it. Very good. Let me have you stand up real quick. And I would like to hold with your hands forward, go up over your head as far back as you can, keeping them straight, down and back behind your, very good. And then I want you to touch your lower back, touch the upper back, arms at the side, go up and over your head, down, and then your right arm cross your body, and then your left arm cross your body. Very good. Hold your shoulders up like this, press against my arm. Very good. Strength is really good. Okay. Alrighty, let me see if we got all of that. Very good. Okay, let me have you remove your shirt, please. And try to sit with your back towards the camera as much as you can. Very good. All right, so here I am going to do my respiratory exam. Can I have you go and take a big breath in? I'm watching my hands expand, equal bilaterally. Make sure I don't feel okay. All right, so next I am going to locate the scapula and I am going to percuss. Very good. Next, I want to tell me if you feel any pain.
No. No.
All right, so we're checking CVA, checking tenderness for possible pyelonephritis. I would be checking the diaphragmatic expansion, usually it's 2 to 3 inches. I'm gonna go ahead and every time I touch your back, I want you to say 99.
99. 99. 99. 99. 99.
All right, so I'm assessing tactile fremitus. It's equal. All right. Next, I will be auscultating, starting above the scapula, going side to side, comparing both sides with the diaphragm of my bell. Go ahead and take a breath normal. Okay, making sure I was listening to the right middle lobe as well. Next, when I press my stethoscope to your skin, I want you to say the letter E, okay?
E. 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 E.
Okay, next I want you to say the word 99.
99. 99. 99. 99. 99. 99. 99. 99.
Okay, so we're listening for egophony and bronchophony. Sounds good. All right. Okay, let's see. All right. I'm also making sure that there's no bruising back there. Let me have you face the camera, please. All right, so I'm gonna go ahead and start percussing. Heart down there. Okay, very good. Looking at expansion for symmetry. All right, I'm gonna go ahead and take auscultation, starting above the clavicle. Go ahead and breathe normal. Okay, lung sounds good. All right. Want to make sure that the anterior posterior is 1 to 2. Looks good. Doesn't look barrel chested. Next, I will be assessing cardiac. So before I listen, I will be starting at the aortic, second intercostal, right sternal border. Pulmonic will be second intercostal, left sternal border. Herb's point will be third intercostal sternal border. Tricuspid will be fourth intercostal sternal border, and then mitral will be fifth intercostal midclavicular. Listening to these sounds, I am going to, I'm assessing to see if there's any heaves or lifts. I don't see any, and then I'm going to palpate for any thrills. And palpating the TMI, which is located at the fifth intercostal midclavicular line. I didn't feel any thrills. Okay, so let me go ahead and auscultate. Okay, now I'm going to listen with the bell. Okay. All right, sounds good. Next, I want to have you lean forward a bit as much as you can while still sitting. I am going to listen with the diaphragm of the bases of the heart. Okay. All right, sounds good. I don't hear any murmurs. Let me next have you sit back, and then I'm going to have you lay down, okay? And go down slowly. At this point, I would have him on a bed that's inclined 30 to 45 degree angle. And can I have you turn your neck that way and turn your neck the other way? I'm assessing to make sure that there's no JVD. It looks good. So I'm going to go ahead and listen to the heart sounds again, starting with the diaphragm of my stethoscope. Okay, listen with the bell. Okay. All right. Sounds good. Next, I'm going to have you lay onto the left side of your body. I'm going to listen to the TMI again using the bell of my stethoscope. Okay. Sounds good. I do not hear any murmurs. You can go ahead and lay flat on your back. While you're sitting there, I forgot something. Can you close your eyes and with your palms face the ceiling? I'm going to place something in your hand and I want you to tell me what it is, okay? What is that?
A key.
Very good. What is this?
11.
Very good. Keep your eyes closed. I want you to tell me what I'm writing. What letter is this?
C.
Very good. And what number is this?
3.
Very good. Okay, so here I am going to be assessing abdomen, making sure curvature, symmetry, looking at skin, distribution of hair. Before I get started, I'm going to take a listen to his bowel sounds in the 4 quadrants using the diaphragm. Okay, next I'm going to listen to his aortic using the bell of my stethoscope. Renal arteries. And then the iliac arteries. Okay, very good. I'm going to be assessing his liver by palpating, trying to measure it. It should be between 6 to 12 centimeters. Let's say I have 8 centimeters. 8 centimeters, very good. I'm gonna percuss for the spleen. Okay. All right. Let me have you take a big inhalation in. Any pain when I?
No.
Okay. I would be seeing if there's a delay and a pause in his inspiration, and if there's pain, he might have cholecystitis. Okay, let's see. Next, we're going to be assessing if he has any appendicitis. First, we'll be doing the Ross Sphinx. I want you to tell me if there's any pain when I do this.
No.
How about when I lift off?
No.
Okay. That's Ross Sphinx. Any pain when I lift off?
No.
Any pain when I lift off?
No.
Any pain?
No.
Any pain?
No.
Okay, so we were looking for rebound tenderness and seeing if he has any peritonitis. Continuing with the appendix, we'll be doing the psoas and obturator test. So for this, I want you to take your right leg, keep it straight, and lift it against my hand. Any pain?
No.
All right, it's a negative sign. So next, I'm gonna have you bend your leg, and then I want you to tell me if there's any pain.
No.
Very good. So negative for appendicitis. Okay. All right. Next, I'm going to do some light palpation of the abdomen, seeing if there's any masses. Any pain when you do that?
No.
Okay. We'll go deeper this time.
No. No pain. No. No.
Okay, very good. Next, I'm going to try to palpate the spleen. Look at the kidney. All right, next, liver and kidney. Okay, very good. We're assessing, see if there's any hepatomegaly or splenomegaly, which I do not feel. Next, I'm going to palpate for the inguinal lymph nodes, seeing if there's any swollen lymph nodes. While I'm here, I can check the femoral pulses. Might as well check the rest of the pulses. Then we do the popliteal. Posterior tibial, and the dorsalis pedis. Okay, very good. Since we're in this position, let me have you, I'm gonna lift your head up. Any pain when I do that?
No.
While I lift up his head, I'm looking to see if his legs bend forward. Could be a positive sign for meningitis. Next, I'm gonna have you lift your leg up, bend the knee, straighten your leg. Any pain?
No.
All right, go ahead and lower that. Let's repeat with this leg. Bend the knee, up, straight. Any pain?
No.
All right, very good. Negative again for meningitis. Next, with your straight leg, I want you to see if you have any pain when I lift it up. Any pain? All right. Any pain?
No.
All right, so we're checking to see if he has any spinal issues and also checking hip range of motion. Looks good. Okay, check the knees. We can do the Lockman test. Okay, here we're looking at skin, hair distribution, see if there's any edema at the ankles, on the feet. Looks fine. Okay. Next, I can move to the feet, check cap refill on the toes. And sorry if that tickles, I do apologize. Cap refill looks good. Look at the bottom of his feet, seeing if there's any wounds down there. Looks fine. I'm going to perform the plantar reflex. Sorry. Anticipatory. You felt it. All right. Very good. Very good reflexes. Next, I will be, your toes are currently pointing at the ceiling. Point them to the wall. Point them inward, outward. And now I want you to press against my hand, and forward. Very good. Let me see you put your ankles in circular motion. Very good. Let me see you wiggle your toes. Okay, very good. Alrighty, so next let me have you sit at the edge of the bed. And in this position, actually let me see if your arms in a circular motion. Very good, all right. While we're here, let me check your reflexes. Hold your arms flaccid. I'll be holding them for you, okay? All right. Okay. All right, let me scoot back on the bed just a little bit. I'm going to be checking the patellar and then the Achilles. Do the other side. Patellar and Achilles. Very good, and we already did the plantar reflex. Okay. Let me have you lift your right knee up, left knee up. Okay, kick your leg out. Very good. Kick the leg out. Very good. Knee up. Again, against me, knee up against me. Put kick out against me, pull back, kick out, pull back. Okay, good. Strength is good. Wonderful. Okay, let me have you stand up. Let me step away from the bed just a little bit. Let me see you kick your leg back, straight. Very good. Do your other leg back. Very good. Let me take your right leg and move it out straight. Do your left leg out straight. And this time I'm gonna do it against my arm. Kick out. Okay. And kick out. Very good. Sorry to throw you off balance, but that was good. All right. Since we're already here in this position, let me have you keep your eyes closed, arms at the side, and if you can hold that, do you feel dizzy or like you want to fall?
No.
Very good. Okay, next time we have you face the TV. I'm going to be assessing the spine. I'm going to have you touch the ground. And as he's going down, I'm making sure that the spine is straight. Go ahead and stand back up. Very good. Let me have you extend your spine backwards. Very good. Go to the right, go to the left, and then now twist your body. Twist, twist. Very good. All right. I want you to face the door, and in your normal walk to the door. Okay, face me. And this time I want you to walk on the heels of your feet. Okay, this time face the door again, and I want you to walk on your tippy toes. And when you return to walking back to me, I would like you to walk as if you're on a tightrope, heel to toe, heel to toe. Okay. All right, I think that's it. Thank you so much for your help.